Hi everyone, I'm Madison Bulkley and I'm presenting on how gender biases affect medical research on women's health. This research stresses the underrepresentation of women in clinical trials and in research and how it affects the diagnosis and treatments and affects women's health. So, the medical research world is often male centric, and this can be seen in medical studies that have excluded female participants and prioritized male subjects. Female bodies were often considered too complex because of hormonal cycles and reproductive differences. Clinical trials have mostly used men as their main or majority of their subjects, and this can lead to dangerous assumptions that women have the same symptoms of diseases and react the same way to medication and treatments as men. Male researcher biases saw that males were a representative of the human species, and so it became the norm to only research them. A study found that women are also underrepresented in randomized clinical trials, with an average enrollment of only 41%, even though they make up half the population. This bias and underrepresentation has had many consequences, including generalization data, diagnosing problems, treatment problems, and a gap in understanding women's health. Many negative effects have come from the significant underrepresentation of women in medical research and in clinical trials. Some examples of this is research providing generalized data that does not reflect human or female health and biology, which can cause gaps of information. This also causes negative impacts in understanding, preventing, and treating conditions that affect women, and understanding how it affects the sexes differently. Some examples of this are cardiovascular diseases, depression, and AIDS. Also, sex and gender need to be considered in medical research because of the differences in fat content, hormones, and metabolism that can affect treatment plans and medications. This can also have negative effects on diagnosis and treatments for women. It can cause delay of treatment, using ineffective treatments, or withholding effective treatments. Other factors can delay diagnosis and treatments for women as well, like how gender biases can affect the perception of female pain. Gender stereotypes can affect how healthcare workers view and treat female pain. This leads to an unequal access of care. Female pain can be seen as excessive since women are often viewed as typically emotional or dramatized. This gender stereotype can cause healthcare workers to underestimate their pain and treat them for psychological issues instead of pain management issues. Viewing their physical pain as psychological pain shows underlying problems in the healthcare system, but the negative effects of this system can also harm the woman by making them feel abandoned by their healthcare professionals and doctor, their family, and their friends, which could exacerbate their problems. This can be seen in one of the studies that explains that for some pain, women are less likely to be prescribed pain management medications, and they're more likely to be prescribed antidepressants to cope with it. Some other consequences women can have to this is misdiagnosis, and misdiagnosis is more commonly happening to women than it is to men, especially in cardiovascular diseases and other conditions like ADHD and autism. Women are also more likely to have negative drug reactions, and one study that I had found that women often feel like they have to prove themselves in that they are in pain and that they're in as much pain as their male counterpart so they can be taken seriously. And this is a phenomenon called Yuntel syndrome. And having the feeling that they need to prove that they're in pain often delays treatment, and it can have negative effects on the woman's well being. Some more specific evidence of disparities in healthcare is that women are often more likely to get diagnosed with heart disease later in life than men, and this could be from tests that are used for diagnosis, like the treadmill tests, which are less effective on women than they are on men. Also, women were found to take better care of themselves after their diagnosis, which made them less likely to need invasive procedures like coronary angiography or coronary bypass surgery. But women were also more likely to be misdiagnosed or discharged with a serious medical condition because they were being overlooked. So, some of the more recent problems in medical research is that in 1977, the FDA created a good guidance practice, which discouraged women of reproductive age to enroll in clinical trials. And they were really criticized for this because groups argued that they should have the autonomy on to decide whether or not they want to participate in these trials. And then up until the 1990s, there was no mandates for including women in clinical trials, so they were getting overlooked. And even now, most drugs are often tested on average ideal men, and the recommended dosage are created by this standard. And this is often referred to even though women and men have different abilities in metabolism and how to metabolize the active ingredients in medications, and this changes the efficiency in them. This underrepresentation prohibits biological understanding and adds to healthcare inequalities that women face. And we can move forward and improve medical research by requiring sex based analysis in clinical trials. And this can help because it's proven to be more helpful outcomes for women when sex based research is a priority. We can also fund more research that focuses on women's health needs and address intersecting biases like race, gender, identity, and age. Also, addressing gender theory in medical schools to help practicing doctors understand and combat it. And this is my presentation.